This is the Pet Buzz.
This is the Pet Buzz.
And here's the Dynamic Pet Duo.
Okay, so February is American Heart Month, and it's important that every dog and cat owner is empowered to recognize signs of heart disease in their pets.
Joining us today is Dr. Bruce Cornreich, Director of the Cornell Feline Health Center and board-certified veterinary cardiologist at the Cornell University of College of Veterinary Medicine, sharing some tips with us about heart disease in our pets. Welcome.
Thank you for having me.
Dr. Cornreich, thank you for joining us.
It's one of those days here at the Pet Buzz. The audio goes up.
All right,
You're crazy.
You're okay. You're with us now.
Okay, so why are regularly veterinary checkups a key component in diagnosing and managing feline heart disease, especially if you have a breed of dog or cat that's susceptible?
Well, thanks for having me. And this is a great question. It's primarily because we want to recognize and diagnose disease early. And in patients that are not showing signs of heart disease, examination by a veterinarian and auscultation, meaning listening with a stethoscope and looking at heart rate and respiratory rate and things like this, may be the first indication of heart disease. So we really want to recognize these diseases early. So visiting a veterinarian is the best way to make sure that that will happen.
Cats, what's the signs of heart disease in cats?
Well, it's important to point out that many cats with heart disease don't have signs or symptoms, but if they do develop symptoms, difficulty breathing, elevated respiratory rate, exercise intolerance, lethargy, and sometimes collapsing. In some cases, a devastating sign can be the development of sudden onset of paralysis. If a blood clot that forms in the heart leaves the heart and goes out to the body and blocks blood flow, usually to the hind limbs. If that happens, that's usually not a good prognostic sign. But most commonly, difficulty breathing, lethargy, exercise intolerance, sometimes collapsing.
When the doctor is auscultating or listening to the heart with the stethoscope of a cat, does he or she always hear a defect in that heart, even though they have maybe heart disease?
It is true. That's a very good question. Many, up to 20% of cats that have heart murmurs don't have heart disease, but conversely, the vast majority of cats that do have heart disease have heart murmurs and or abnormal heart sounds on auscultation.
Great.
So I guess especially with cats, you really do need to make sure you go to the veterinarian 1 to 2 times a year, get your cat checked out, because
Absolutely.
you never know. The signs are almost not there unless the cat is, like you said, really have difficulty breathing, correct?
That's correct. That's really is important because cats can mask signs of heart, or they may not be showing obvious signs of heart disease to owners.
It seems like typical with cats because, it's like they I shouldn't say this, they wear those diseases so well. They don't give it up, right? They don't.
I would agree with that. I would agree. Cats are good at hiding signs of disease.
Absolutely. And that's why I wanted to point that out for our listeners, our cat listeners. It is really hard for us as practitioners to discover that there's heart issues. So thank you for helping us and letting them know that.
Also. Oh, of course. My pleasure.
Let's talk dogs.
Let's talk dogs. What about dogs?
Okay. Well, dogs exhibit many of the same signs: difficulty breathing, accelerated respiratory rate, lethargy, exercise intolerance, collapsing. The big difference and the primary distinguishing factor is that dogs will often cough if they have heart disease. It's very uncommon for cats with heart disease to cough.
Huh. So cats can't cough, but dogs can. Okay.
Cats can cough, but they often cough for non-cardiac reasons.
I've never heard a cat cough. Have you ever? Well, I guess you have. You're a vet.
Yeah, but that's my whole point in trying to diagnose heart issues with cats. It's really hard for us as practitioners. So pet owners, have some patience.
I think.
Yeah, and of course. Oh, I'm sorry. I was going to say, to complicate the issue, many cats, a fair number of cats that have heart murmurs don't have heart disease. Conversely, the vast majority of cats that do have heart disease have murmurs or abnormal heart sounds on auscultation.
Okay, what about dogs?
Dogs, again, usually dogs that have heart disease will have murmurs, clinically significant murmurs. Dogs can also have heart murmurs when they're young. We call them physiologic or flow murmurs that are not associated with heart disease, and they will grow out of these usually by 8 to 12 weeks of age. That's not as common in cats. So dogs, usually, if they have heart disease, they will have heart murmurs, unless they're very young, in which case they may have very low grade, what we call physiologic flow murmurs that abate with aging.
I think one of the things that's interesting is I think that unless you have a breed like a King Charles Cavalier that has questionable heart issues, people never really thought about it if in other breeds of dog, unless that breed specifically was known to have heart disease. I think one of the things that brought heart disease and heart issues to the front has started happening a few years ago with the pet food and dogs, and all of a sudden everyone was talking about dogs' hearts.
Sure. And again, there are many different types of heart disease. So, for example, the importance of having young animals examined is that you can identify what we call congenital heart defects, which are defects, abnormal development of the heart and defects that are present at birth, as opposed to what we call acquired heart disease, which are diseases that occur as a patient ages. And so King Charles Cavalier Spaniel being kind of unfortunately,
the poster child
for myxomatous mitral valve degeneration. That would be an example of a disease that would be acquired later in life.
Yep, we see so much of it today because our pet industry, our pet people, our pets that we have as part of our family, they're all aging, just like us.
Just like you.
Just like me.
Okay. It's interesting because I'm just curious. I'm hearing this conversation, learning about osculating and everything else.
Auscultation.
Auscultation.
Yes.
I'll say it 5 times fast after the show. So if your dog or cat has heart disease, is it best to see a specialist to manage pet health?
Well, often what happens is it may be that a general practitioner, for example, might recognize an abnormal physical examination finding like a murmur or abnormal heart rate or something like that on an exam. And in those cases, it's usually ideal to be referred to the cardiologist, at least for initial diagnosis. In many cases, it may be a matter of expertise. It may be a matter of availability of certain types of equipment. So to make a diagnosis, often it's preferable to go to a specialist. Having said that, in many cases, the management over time can be handled by a general practitioner, usually working in collaboration with a cardiologist.
What's going on in the background over there? What's happening at Cornell? That snow is not making all that noise.
Oh, sorry. I'm actually, I'm not at Cornell. I apologize. Probably some of that was my dog eating.
Ah, okay. That's funny.
So how is heart disease treated in dogs and cats, and is it comparable for the treatment in humans?
Great question. It really depends on the type of heart disease. So there are congenital defects, which are abnormalities of cardiac development that can be treated sometimes with interventional procedures, either surgeries or the placement of devices through the vessels, through the blood vessels, less invasive. In many cases, they're treated, the majority of cases, they're treated with oral and injectable medications. And there are many similarities between the ways that we treat heart disease in cats and dogs and the way that it's treated in humans.
It's kind of cool. I love hearing that because, we see so many more, like whether it's dogs and cats, or dogs specifically helping humans and humans helping animals in various
I must make a comment here about cardiologists, veterinary cardiologists. We need more of you, because all my cases, I can't refer to anybody because we can't get in for a year because there's not that many of you, right?
It is a pretty small group and it's growing. We're pretty busy. And of course, the thing is, COVID has made it so that for a while, things changed and we're sort of catching up at this point. But yeah, it's a growing group, but it's still pretty small.
It's very small, very hard for me to refer. Just had to make that comment.
I'm sure isn't there somebody at University of Florida?
There's somebody at the University of Florida, and there's a couple of other cardiologists in the state, but there's a small number of cardiology specialists in the United States.
Yes, that's right. And there are great people at Florida. But yeah, I agree. It's growing, but still small. And of course, we're always doing the best we can.
Well, this was such a great interview today with Dr. Bruce Cornreich, director of the Cornell Feline Health Center and board-certified veterinary cardiologist at the Cornell University College of Veterinary Medicine, sharing his tips about heart disease in dogs and cats. You know, it's important that it's nice to know that February is Healthy Heart Month.
Yes.
But it's really important. You got to do it all year round. You got to check out your dogs and cats all year round.
Absolutely. Be proactive about your pet care as you are about your own care. The earlier we diagnose diseases, the better the outcome.
Thank you for listening to this episode of The Pet Buzz.